Hello, welcome to the clinic. Get my hands clean here for you. I'm going to introduce some tests that you may not have had before and incorporating some new equipment. Okay, don't worry if you have had some of these. I'm guessing the majority you haven't. Okay, so we're going to do an ocular staining. I'm sure many of you have had ocular staining with the fluorescein dye vital stain there. It is most commonly used today. But how about we do an ocular staining using another vital stain, Lissamine Green staining, in the sterile packaging there, sterile strip. If I pop a bit of Lissamine Green into the eyes to check for any devitalised or dead cells with the staining, let's just wet the tip. Okay, looking up for me, it doesn't sting. The slightest bit of Lissamine Green dye there, thank you. Let me just dispose of this now. Single use. Okay, and to check for the staining, the conjunctival and corneal staining, I'm going to have a look at your eye with the green light. So please look straight ahead to begin with. Now look to the left, please, to check the conjunctiva. Now look right. Look up to the ceiling now. Just look down as I lift the top lid, please. Okay, we may avert the lid a little bit later for a closer inspection. Look straight again and blink for me. Excellent, that's the right eye with the Lissamine Green staining check. Look straight ahead again for your left eye review. Now blink, please. Now look to the right. Look left. Look up now. Look down as I lift the top lid on the left side. Straight ahead again, thank you. That's probably your first vital stain check with the Lissamine Green. Excellent. So let's record those results down and then move on to the second test. We may have another vital stain to show you afterwards, which you've probably never had before. Okay, let's move on to a small hearing test. Have you ever had audiometry performed with the handheld device here? It presents some sounds that you have to say whether you hear. We get some nice clicking sounds from the buttons here. 500 Hz at 60 decibels. And as we go along, I'm going to be plotting your results on the audiograph there. I'll place your details there and record there for you. So I'm going to place this over the right ear. Tell me whether you hear the sound. Nice and simple test. Thank you. Let's decrease volume there to 50 decibels. Just about, excellent. I'm going to increase the frequency to 1000 hertz. Can you hear this sound? Marvellous. And here, please. Brilliant. So that's two different frequencies. So we had 500, 60, 1000, 60 and 50. Let's move on to your left side now, please. Just saying whether you hear this sound. Marvellous. And the second. Good. Up to 1000 hertz now. Good. And just reducing down a little bit here. Can you hear this? Excellent. So that's the audiometry hearing test, handheld device. Many of you have used the earphones before, but hopefully that's a new one for you. So left results 500 hertz, decibels 60, 50, and that's audiometry, thank you. Okay, so I'm aware that you've had convergence and ocular motility performed in the clinic before, but we're going to introduce a new piece of equipment to perform those tests. Have a look at these beautiful pieces of equipment, the beautiful flowers. We have the floral design here at the back and a scale there for performing some precise ocular measurements. Let's get started with convergence using this beautiful flower here. Eyes on the flower, following. Let me know if you see double vision at all. Good. And again, is that single? Any double vision there. Okay, let's use the second trigger for ocular movements. Follow this just with your eyes, please. The beautiful flower. Observing the movements, looking for any anomalies. You should report any double vision or discomfort, please. Good. And up, and down, up, and down. Lovely. Convergence and motility. It's only right that we incorporate the measuring scale here. Check your vertical apertures, the palpebral apertures, look straight. And for the left, please. 11 millimeters, lovely. Just from the side here, to check the maximum eyelash length. Side there, lovely, thank you. And maybe just your iris diameter. Okay, just look into my open eye, please. And the other eye. 12 millimeters there. So that's using the new ocular triggers. Checked your convergence, ocular motility, and we took some ocular measurements there. Lovely, progressing well. Okay, I'm going to show you a new trigger that will be used in the eye hospital for Chalazion surgery, potentially. And it's housed in this protective case here. This is the Chalazion clamp here. So by just rotating the dial there, we increase the distance between these two surfaces there. Now this is hollowed out so that the Chalazion can come into the space there, ready for surgery. Okay. And this will go inside the lid and then can be brought into a secure but comfortable distance, and then the surgeon can perform the surgery. Now this part here, the hollowed out part where the Chalazion protrudes through, comes in different diameters and different shapes depending on the size of the Chalazion. So those are the surgical Chalazion clamp there. Thank you. Okay, the next trigger is a dental one. Something I've been recommended, but I may not have shown you in the clinic previously. We have these little Interdental flossing sticks. So we hold it like this, and you can bend the tip there to fit between the spaces of the teeth, and then you just want some little back and forward movements to clean between the teeth. Good to do before brushing and mouth washing. So let me just demonstrate the interdental brushing between your teeth. Okay, so just open wide, please. Okay, we'll try the lower rows there just so you can experience and see how it feels. How does that feel between the teeth? Excellent, thank you. That was the interdental flossing brushes there. Okay, I'm going to check your tear production performing the Phenol red thread test. Let me just take this thread here. Okay, we're just going to bend the sterile strip, place it over the lower lid. There, thank you. And I'm going to give that 15 seconds. Just look straight ahead and blink normally. Thank you. Now I have the strip. Let's measure the tear production there. Okay, 35 millimetres. Let's get a fresh one for the left. And I'm just going to place this the lower lid here. Okay, give that 15 seconds. Just look straight ahead and blink. Okay, let's for you. Let me measure the red part there. It tells me that we have about 37 mil of tear production there. It's positive results, thank you. Doesn't appear to be any deficiencies in tear production. Okay, we did say we was going to do another final vital stain for the eyes, now that the Lissamine Green has drained out. We're going to do the Rose Touch, Rose Bengal Ocular Staining. Okay, there it is. In the package there, the sterile strip. Okay, it may feel a little bit more uncomfortable than the Lissamine Green. Just let me know how it feels. So looking up, some Rose Bengal, and that one. And for the other one there, marvellous. Take a few blinks, please. And have another look at the ocular surface. Thermoscope. Okay, just look straight ahead again, please. Blink. Okay, look up. Look left. Look to the right. Looking down again, please. Straight ahead now. Excellent. That's the right eye Rose Bengal staining check. For the left, look straight. Okay, take a fast blink. Look down for me, please. Okay, looking right, left, and up. Good, that's the Rose Bengal staining completed, thank you. Alright, now we're on to a vision test using an app this time. So I want you to cover your left eye. I'm going to show you some single letters. Just say the letters you can see there, from top to bottom, please. Good, and I'll change them for you. Try those. Excellent. And let's try some shapes here. Tell me the shapes, please. Top to bottom there. Excellent. And let's try these shapes. Okay, and those, please. Lovely. Cover the other eye now. Starting from the top, say the shapes on the rose there, please. Excellent. Just attempt the bottom row when you're ready. Thank you. Okay, some tumbling ease. Just tell me which way they're tumbling, please. From top to bottom. And try those letters, please. And these letters. Okay, both eyes open now. Try these letters with both eyes open. Top to bottom there. For the bottom. Let's finish off with some numbers there. Say the numbers you see, please. Excellent. So I think that concludes all the tests today. Let's just record the results. So we've done Lissamine Green, ocular staining, some handheld audiometry. We've done some convergence motility and ocular measurements with the new device. I've showed you the Chalazion clips, interdental brushing with demonstration, phenol red thread for tear production, Rose Bengal staining, and the Vision Phone app. Thank you. That's everything today.